Right now, while you are sitting there listening to me, your body may be whispering to you that something is running low. Not shouting, whispering. It shows up as a strange tingling in your fingertips, like the pins and needles you feel when your hand falls asleep, except it does not go away. It shows up as a tiredness so heavy that a full night of sleep does not touch it. It shows up in the mirror, on your tongue, and in the color of your face. And here is the part that worries me most. Most seniors look at these quiet little signs every single day and brush them aside as nothing more than old age. They are not nothing. Very often, they are the early signs of a vitamin B12 deficiency, and according to the National Institutes of Health, this shortage affects a large share of older adults, by some estimates anywhere from 3 to more than 40 out of every 100 people over 60. The good news, the wonderful news, is that once you know what to look for, this is one of the easiest problems in all of medicine to catch and to correct. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, and I have sat across the desk from countless men and women over 60 who came to me feeling worn down, foggy, and afraid that they were simply falling apart. They had been told it was just their age. And again, a single simple blood test told a very different story. So if you have been feeling unlike yourself, I want you to take a slow breath, relax your shoulders, and stay with me for the next few minutes. Because what I am about to show you could explain so much, and the path back is gentler than you think. Before we go one step further, if you find that health information explained in plain, calm, honest language is helpful to you, please take 1 second to like this video and to subscribe to the channel. It genuinely helps me reach more seniors who need to hear this, and it costs you nothing at all. Now, let me tell you why this one little vitamin matters so much, and then I will walk you through the 5 signs to watch for, one by one. Let me start with what vitamin B12 actually does inside you, because once you understand its job, every one of these signs will suddenly make perfect sense. Vitamin B12 is a tiny nutrient with 2 enormous responsibilities. First, your body uses it to build healthy red blood cells. Those are the cells that carry oxygen from your lungs to every corner of your body, to your muscles, your heart, and your brain. Second, your body uses B12 to protect and maintain your nerves. Think of your nerves as the electrical wiring of a house. Each wire is wrapped in a protective coating, the same way the cord on your lamp is wrapped in rubber. B12 helps keep that protective coating healthy. When the coating frays, the signal gets noisy and unreliable, and that is when the tingling, the numbness, and the unsteady feet begin. So you have a vitamin that keeps your blood rich with oxygen and keeps your nerves properly insulated. When it runs low, you would expect to feel tired and weak because your tissues are not getting enough oxygen, and you would expect strange sensations in your body because the wiring is misfiring. And that is exactly what happens. Hold that simple picture in your mind, oxygen and wiring, and the 5 signs will line up like dominoes. Now, why are seniors hit so much harder by this than younger people? This is the part that almost nobody explains, and it is so important. To pull B12 out of the food you eat, your stomach needs to make a good, strong splash of stomach acid. That acid is the key that unlocks the B12 from the meat, the eggs, and the dairy on your plate. Here is the trouble. As we get older, the stomach naturally makes less and less acid. The National Institutes of Health points out that many older adults simply do not have enough stomach acid to absorb the B12 that is sitting right there in their food. So you can eat a perfectly good diet, full of the right foods, and still slowly fall short, because the key that unlocks the vitamin has grown weak. It is like having a pantry stocked with cans, but a can opener that no longer works. And there is more. 2 extremely common types of medication can lower your B12 even further. The first is metformin, one of the most widely used medicines for type 2 diabetes. Research summarized by the National Institutes of Health shows that metformin can reduce how much B12 your body absorbs and can lower the level of B12 in your blood over time. The second group is the acid reducers, the medicines so many of us take for heartburn and reflux. Medicines like omeprazole, lansoprazole, and the older ones like cimetidine and ranitidine, because they quiet down stomach acid on purpose, and because stomach acid is exactly what you need to free up B12 from food. Taking them for a long time can leave you short. Now please hear me very clearly on this. I am not telling you to stop any of these medicines. They are important, and many people truly need them. I am simply telling you that if you take them, you have a very good reason to ask your doctor a simple question, which I will give you at the end. Knowledge here is power. All right, let me give you the 5 signs to watch for, the ones most seniors ignore. I want you to gently check yourself against each one as we go. The first sign is a deep, unshakable fatigue. Now, I know that everyone feels tired sometimes, and tiredness alone proves nothing. But this is a particular kind of tiredness. It is the bone-deep weariness of a body that is short on oxygen. Remember, B12 builds the red blood cells that carry oxygen. When B12 runs low, you make fewer healthy red cells, and the ones you do make can come out too large and too few to do the job well. Doctors call this a type of anemia. With less oxygen reaching your muscles and your brain, you feel drained, breathless on the stairs you used to climb easily, and your heart may even race a little as it works harder to push what oxygen you have around your body. Let me tell you about a patient. I will call her Eleanor. She was 71, and she told me she had simply accepted that she was old and tired, that this was her life now. She napped twice a day and still felt hollow. Her skin had gone pale, almost waxy. We checked her B12, and it was very low. Within a couple of months of treatment under our care, she told me she felt 10 years younger, and she had started gardening again. Her fatigue was never old age. It was a vitamin her body could no longer pull from her food. The second sign is tingling or numbness in your hands and feet. This is one of the most telling signs of all, and it is the one I most wish people would stop ignoring. It often begins as a pins and needles feeling in the tips of your fingers and toes, the same sensation you get when a foot falls asleep, except it lingers and slowly creeps inward. Some people describe it as a buzzing, or a feeling that they are wearing invisible gloves or socks. This is the frayed wiring I described earlier. When B12 runs low, the protective coating around your nerves begins to break down, and the nerves furthest from your spine, the ones in your fingers and toes, are usually the first to complain. Please do not wait on this one. Nerve symptoms are your body's way of asking for help early, and the sooner B12 is restored, the better the chance those nerves recover fully. The third sign follows naturally from the second, and it is one that frightens families more than almost anything else. It is trouble with balance and unsteadiness on your feet. When the nerves in your legs and feet are not carrying their signals cleanly, your brain loses some of its sense of exactly where your feet are on the ground. In the daylight, on flat carpet, you may manage just fine, but in a dim hallway at night, or stepping off a curb, that lost feedback can make you wobble, reach for the wall, or feel like the floor is not quite where you expected it to be. For an older adult, a fall is a serious thing, and so a creeping unsteadiness is never something to wave away. If you have noticed that you feel less sure on your feet than you did a year or two ago, especially alongside any tingling, B12 deserves a place on the list of things your doctor checks. The fourth sign is one you can actually see in your bathroom mirror, and it is remarkable how specific it can be. Look at your tongue. A healthy tongue has a slightly rough, textured surface, covered in tiny bumps. When B12 runs very low, the tongue can become smooth, swollen, and an angry, beefy red, almost glossy, as if those little bumps have been ironed flat. Doctors have a name for it, glossitis, but you do not need the fancy word. You just need to know that a sore, smooth, unusually red tongue, sometimes with a burning feeling or small mouth ulcers, is a classic clue that B12 is low. While you are at that mirror, look at the color of your skin and the whites of your eyes too. Because of that oxygen-poor anemia we talked about, the skin can turn pale, and in some people it takes on a faint yellow tint, a mild jaundice, where even the whites of the eyes look slightly yellow. Pale or faintly yellow skin, alongside a smooth red tongue, is your reflection trying to tell you something. The fifth sign is the one that worries seniors the most, and it is changes in your memory, your thinking, and your mood. Because B12 protects your nervous system, and your brain is the grand headquarters of that system, a shortage can show up as forgetfulness, mental fog, difficulty concentrating, or a low, flat, irritable mood that does not lift. So many people and so many families see these changes in an older loved one and quietly assume the worst, that this is the beginning of dementia and that nothing can be done. And here is why I am so passionate about this video. Sometimes it is not dementia at all. Sometimes it is a low vitamin, and a low vitamin can be corrected. I am not promising that B12 explains every memory problem, because it does not. But it is one of the simplest, most treatable things to rule out, and it would be a tragedy to miss it. Let me tell you about another patient, a gentleman I will call Frank. His daughter brought him to me, deeply frightened, because Frank had become forgetful and withdrawn over several months, and she was certain she was losing her father. Frank had type 2 diabetes and had taken metformin for many years. We checked his B12, and it was strikingly low. We will never know for certain that B12 explained everything, but with treatment, his energy returned, his mood brightened, and his daughter told me she felt she had her dad back. That is the kind of story that makes me want every senior to know these signs. Now, let me bring these 5 together, because they rarely arrive alone. The reason B12 deficiency fools so many people is that one sign on its own looks like simple aging. Tired, you are getting older. Tingling toes, probably your circulation. Forgetful, just a senior moment. But step back and look at the pattern. Deep fatigue and tingling hands or feet, and a little unsteadiness, and a smooth red tongue with pale skin, and a cloud over your memory or mood, all appearing together. That pattern is not ordinary aging. That pattern is a body asking for a vitamin. The signs do not have to be severe. Even a few of them, mild, are worth paying attention to. So what do you actually do about it? This is the most important part, so please listen closely. You do not diagnose yourself, and you do not start buying high-dose supplements on your own and hope for the best. Instead, you do one simple, powerful thing. You ask your doctor for a B12 test. That is the whole key. It is a simple, inexpensive blood test. You can say it in one sentence. Doctor, I have been noticing some of these signs, and I would like you to check my vitamin B12 level. Especially bring it up, and I mean this firmly, if you take metformin for diabetes, or if you take an acid reducer for heartburn, or if you are a vegetarian or vegan, because B12 comes mainly from animal foods. Those situations all raise your chances, and a simple test settles the question. Here is a common mistake I want you to avoid. Do not assume that because you eat plenty of meat and eggs, you must be fine. As I explained, the problem for many seniors is not what is on the plate, it is the stomach acid that has grown too weak to unlock it. That is exactly why testing matters more than guessing. And here is a second mistake. Do not start a B12 supplement on your own right before your appointment, because it can mask a low level on the test and muddy the picture. Let your doctor guide the order of things. Now for the encouraging part, the treatment. When a deficiency is found, fixing it is usually straightforward and is something your doctor will tailor to you. For many older adults, the National Institutes of Health notes that B12 from supplements or fortified foods is actually absorbed more easily than the B12 locked inside food, because it does not need as much stomach acid to free it. Depending on how low you are and why, your doctor may recommend a daily oral supplement, or in some cases injections, to fill the tank quickly. The point is, this is a fixable problem with a clear path, and people very often feel dramatically better once their level comes back up. I have watched it happen more times than I can count. Let me give you a small, practical habit to fold into your life. The next time you brush your teeth in the morning, take 3 extra seconds to look at your tongue and the color of your face in the mirror. A healthy pink textured tongue is a quiet good sign. A smooth, glossy, beefy red one is worth a phone call. That tiny daily glance turns your bathroom mirror into an early warning system that costs you nothing. And here is a bonus tip that stacks on top of it. Keep a short, honest list of how you have felt over the past few months. Jot down whether your energy is down, whether your feet tingle, whether your balance feels off, whether your memory has slipped. Bring that little list to your appointment. Doctors make far better decisions when we can see a pattern over time instead of just a single moment in the office. And your written list is one of the most helpful things you can hand me. Now the safety part, because I always promise you honesty. The signs we covered today, tingling, numbness, unsteadiness, memory changes, and pale skin, can be caused by many different things, not only by low B12. That is the whole reason I keep steering you toward your own doctor, rather than toward self-diagnosis. If your tingling or unsteadiness is getting worse quickly, or if you ever have sudden weakness, slurred speech, drooping on one side of your face, or confusion that comes on fast, please do not wait. Treat that as an emergency and call for help right away, because those can be signs of something that needs care that very minute. And once again, never stop or change any medication, including metformin or an acid reducer, on your own. Bring your questions to your doctor and let them guide any changes safely. The goal is always to work together with the people who know your full health history. So let me bring this all together for you. Vitamin B12 does two great jobs. It keeps your blood rich with oxygen, and it keeps your nerves properly insulated. As we age, our stomachs make less of the acid needed to pull B12 from food, and common medicines like metformin and acid reducers can lower it even further. When B12 runs short, your body whispers it in 5 ways: a deep, unshakable fatigue, tingling or numbness in the hands and feet, unsteadiness on your feet, a smooth, sore, beefy red tongue with pale or faintly yellow skin, and changes in memory, focus, and mood. One sign alone may mean little, but together that pattern is worth taking seriously, and it is so very treatable. You do not need to be frightened by any of this. You need only to be aware. The single most powerful thing you can do after watching this video is to bring one calm sentence to your next appointment. Doctor, would you please check my vitamin B12 level? That one question has changed the lives of more of my patients than I could ever tell you in a single video. If this was helpful to you, and you would like more simple, honest explanations of the signs your own body is showing you, please subscribe and join us here. This channel exists to help you stay strong, clear, and independent well past 60, and I would be honored to be a small part of that journey. Take good care of yourself, and I will see you in the next one. And one quick and important note before you go. This video is for general educational purposes only, and it is not medical advice. Everybody is different, and the signs we discussed can have many causes. Always speak with your own qualified healthcare provider before making any changes to your diet, your supplements, or your medications. Your doctor knows your body and your history, so bring these ideas to them and let them help you use this information safely and well. Just socially.